name is Mrs. Andrews, and today I'm going to be doing an instructional video on IV insertion. So we're going to go through the checklist, and I'm going to give you some additional hints, tips, and tricks for IV insertion. Alrighty, like we always start off with, we want to verify our healthcare prescription order, and we do have one. So I am going to make sure that I have the correct supplies to perform this skill. I have got my normal saline flush. I have a 22 gauge IV catheter needle. I have an extension tubing, and I have an IV start kit. Okay, so now I'm prepared to go into my client's room. I'm gonna wash my hands as I'm coming in, and I'm going to say, "Hi, my name is Mrs. Andrews. I'm going to be your nurse for today. Can you please verify your name and date of birth?" They say Sam Temple, 9155, and that matches the wristband. Thank you, Mr. Temple. Can you tell me if you have any allergies? No allergies. Fantastic. So, what I'm going to do for you today is just start an IV. I'm just going to put a bendy plastic tube into your vein. That way we can give you some medication so you can feel better and get out of here, okay? All right, any questions? No? Awesome. So, I'm going to go ahead and open up my supply kit so I can get my tourniquet out. Now the tourniquet you want to make sure is nice and tight so that way the veins pop up. And it should be in a quick release knot. Okay, super. And I'm looking at my veins, and I found a nice bouncy vein. Okay, I want to make sure that I release my tourniquet within 2 minutes of applying. So I'm going to do that now. While my client's arm is resting, I'm going to go ahead and prepare the rest of my supplies so I can begin my insertion. So from my IV kit, the solution that comes in your IV start kit is actually not compatible with the mannequins, so please don't actually use it on them. If you feel like you want to see something that is wet on your site so you can simulate that, you can use alcohol. Okay. So I'm going to go ahead and get my Techoderm ready. I'm just going to bend the back of it so that way once I've got my catheter in, it's very easy to pull off. I'll set that to the side. I'm going to open up my IV needle, leaving it in the container so it remains aseptic. I'm going to open up my extension tubing, and I will attach my pre-filled saline flush to it. Without touching the ends of this extension tubing, I'm just going to pick it up. And I'm going to apply my flush, and I'm going to prime my line, which means I'm pushing the air out of the line. And here's a hint, you're going to want to loosen this cap, because once you get to this step, whenever you're attaching it to your catheter, you're only going to have one hand. So I've loosened my cap. I'm going to set it back into the kit to keep it aseptic. And now I'm going to go ahead and reapply my tourniquet 4 to 6 inches above my insertion site. I'm going to wash my hands and apply clean gloves. I'm going to use my facility approved cleanser to clean my site, starting at where I plan to put my catheter into the vein. Okay, and I'm going to scrub nice and hard, and I'm going to work my way out in a circular motion. And once I'm done cleaning, I'm not going to fan or blow on the site. I'm going to allow it to air dry. Once that's dry, I'm gonna grab my IV needle. I'm gonna take off the cap. And I'm gonna make sure that my catheter actually is gonna slide off of my needle. I'm just gonna make sure that it's working properly, and it is. I'm gonna go ahead and anchor the vein. For this site in particular, I'm gonna use my thumb to hold the skin taut like this, and that should stabilize my vein or anchor it. And then I'm going to go ahead and insert my needle. Once I'm in the vein, I'm going to advance my catheter while holding my needle still, which means I am sliding the catheter into the vein. I'm not pushing my needle into the vein. My catheter is all the way in. I'm going to occlude the vein, stabilize my catheter, and notice how I'm not touching the insertion site because that would contaminate it. Without pulling my needle out, I'm going to activate my safety. This sharps goes in the sharps container. Okay. And I'm going to grab my extension tubing. I'm going to take off that cap and I'm going to attach it to my catheter. Now that that's attached, I can release pressure, and I'm just stabilizing my catheter to make sure it doesn't slide anywhere. I'm going to go ahead and release my tourniquet, and I'm going to flush my IV while observing for swelling, and I'm going to flush with 2 to 5 mLs. I don't see any swelling, so I'm going to go ahead and apply my Tegaderm. So I'm going to move my hands down here just to my pigtail or extension tubing to make sure that my IV doesn't go anywhere. And I'm going to ensure that the IV site is in the very center of my Tegaderm so I can see it when I need to assess it. The Tegaderm is also going over where the extension tubing and the catheter meet. That acts as an additional stabilizer. I'm making sure that my dressing is totally occlusive. And I will remove the paper around the site. Okay. I'm going to make sure that I tape my pigtail or extension tubing. And I like to tape it across there again just to make sure I'm stabilizing that area. Okay, and I'm going to remove my flush. I'm no longer using it. Okay, I'm going to take off my gloves, wash my hands, and then I will label my IV dressing according to policy, which here will be our date, time, and initials. And I will place that on the IV site so that way I can still see where the catheter is going into the skin. Okay. And that concludes the instructional video for IV insertion.